Alrighty, let's move on to my second experience as a reflective individual. So, during my second to last semester of nursing school, I had the wonderful opportunity to witness a C section birth. And this patient was an African American lady who was incredibly expressive with her pain, and she was expressing distress throughout almost the entire thing. And although I wanted to comfort her, I refrained from doing it because she was surrounded by actually qualified nurses and other healthcare workers who I thought should have been consoling her, not me. And I just felt really awkward going up as a male and also as a student when I thought the qualified people should be doing it. And upon reflecting upon this experience and after receiving some feedback from my clinical instructor, I came to realize that it's never wrong to comfort a patient. And I use this experience to assist me in a future experience in my final semester. So, in my final semester, I had a patient who had necrotizing pancreatitis, which is just one of the most incredibly painful conditions you can get out there. And they also stopped accepting treatment at the time. So, as we were in there, my nurse received a phone call and she left the room. And normally I would follow the nurse out, but once again, that conscious told me to stay in the room for some reason and just, even though it wasn't necessarily the easiest choice, just to spend a little more time with them. And so I remembered that experience before where I learned that it's never wrong to console a patient. And so I just stayed with them. I held their hand as they started crying and just kind of telling me about their experience and how scared they were and how much they wanted to help their little boy who was also in the hospital. And I just actively listened to them, asked them questions, and heard out their concerns. And at the end of the conversation, the patient let out this big sigh and just thanked me for listening and that it had really helped them feel a bit better. So, what did I learn about being a reflective individual? I think I realized that even if you failed once, it may have actually just been a learning experience to prepare you for something more serious next time. And of course, I also learned that it is never wrong to comfort a patient. So, when it comes to how this ties to my public issue, I think that this experience really taught me the value of second chances, in that just because something was done wrong the first time doesn't mean that the pattern has to continue. And this is really true with GMOs as well. Just because people are used to buying them does not mean it must continue. And it is of utmost importance to educate families on ways to change their dietary habits and the value of organic choices.